All right. Well, thank you everyone for joining us today. I'm going to go ahead and introduce our speakers. First, we have Thomas McGloshen, who is a licensed professional clinical counselor and a marriage and family therapist and he owns his own private practice, it looks like, which is great. And he is a class of 60. And then we also have Kaylea Ramey Smallwood, who is class of 08. And she is a director of clinical operations at Beacon Health Options, which is a division of Anthem. So these are going to be our speakers today, and you guys hold on tight. They're going to kind of give you guys some advice and have really good discussion, and there will be some time at the end for questions. Whoever would like to go first, you can go ahead and start us off.
You?
Oh, sure. Thank you. Alrighty. Hi, I'm Kaylea. Like she said, I graduated in 08. Once I graduated, I had my from center with a bachelor in psychology and a minor in Spanish. I went straight into UTK, UT Knoxville, to get my master's in mental health counseling. Once I got my master there, then I moved up to Louisville, Kentucky, where I practiced with my LPCA, which is the, I guess, first level entry for the licensed professional counselor associate in Kentucky, where, you still have to have supervision and all that. So I worked for about a little over 3 years doing in-home therapy in Louisville, where I did in-home therapy for at-risk families at risk of losing custody of their kiddos, either due to out of control children or other issues going on in the family with parenting and stuff. So once I got my independent license there, then I moved into working for Beacon, which is where I'm at now. I started working what's called utilization management, so reviewing higher level of care admissions for hospitals, mostly focused in Kentucky. I worked on a plan called Passport, focused on their Medicaid population, doing utilization management for hospitals and PHPs and kind of all those different levels of care. And so since I've been there for it'll be 7 years in February. And so while I've been at Beacon, part of my work, I have to maintain my license. And so, I still have my clinical license, doing my CEUs, doing the therapy. And so applying the clinical knowledge and experience there with kind of how insurance works and how to do utilization management, how to help expand access to care and kind of work that side of it. When I interviewed for where I'm at now at Beacon, I'm kind of considered the bad guy, the dark side. So, I figured it would be nice, if anybody wanted to talk about, being able to get your clinical, get the experience, and then kind of move into this kind of meta work, then I'm here for those kind of questions. So I know that was faster than 5 minutes. I apologize. I talked a lot faster because I'm anxious. So
oh, you're good. You're good.
If we move into, I guess, Thomas, and then I guess we can take questions and stuff from there.
Okay. Yeah, I'm Paul McGloshen, class of 60. I grew up in Louisville, went to Eastern High School, came to Center, and as did my father, who was in the class of 35, and my sister in the class of 65, and daughter in the class of 90. And if Michelle were here, I guess they overlap somewhat. After Center, I went to McCormick Theological Seminary in Chicago. It's a Presbyterian school, and it is a 3-year program, just like law school. Graduated in '63, and became a Presbyterian minister and worked in Russellville, Kentucky for 5 years, from '63 to '68, and left that because I figured it just wasn't really, all of that wasn't for me, and I'll get back to that aspect of it. Moved to Bowling Green, Kentucky, and for 9 years I worked at the Barren River Comprehensive Care Center doing outpatient psychotherapy. My title was Pastoral Alcoholism Coordinator. So I was the one responsible for alcohol and drug programming, treatment, and education. While I was there, I went back to Western Kentucky University, got a master's degree in psychology with a minor in marriage and family therapy. Moved to Columbus in 1977, 78, 77, and to work at the Midwest Career Development Center, which was a career development program for ministers, ministers of all denominations, some of whom were in trouble with their congregations, some were looking for retirement, some just wanted to get a better handle on where to go from where they were career-wise. So I've done some career work in that regard. I left there after 3 years, and in April of 1981, I was there from 78 to 80, and in April of 1981, I started my own practice with the Dublin Community Church. The minister there was looking for help doing counseling because he had more than he could handle. And he had a social worker and a school counselor helping him. So he was glad to have me join the group. And there was 2 good guys I was working with. And at the same time, I also started a PhD program at Ohio State University in family relations and human development with a minor in psychology. So I've had essentially 4 jobs. From a career standpoint, I think I've had 1 career, and my career is as an educator and a therapist. I told myself when a pastor, I really worked on researching and writing and presenting a quality sermon that was socially relevant, theologically sound, and doing counseling as the need arose. I'm a committed introvert and did not like going out calling on people just to chat. But if they were in trouble, they knew they could count on my being there. I did the same thing at the Grand River Comprehensive Care Center, but also initiated the staff development and training program for our whole 10-county region. I was then appointed Director of Emergency Services, set up the program, trained the staff, did the same thing for another program in Owensboro. Came to Columbus to do career counseling, left that after 3 years, and I've been in private practice as a clinical counselor and as an independent marriage and family therapist, and I'm a supervisor in both those programs. So from a career development standpoint, I suggest, folks, that if you've got career assessment available to you, take advantage of it. Not so much to learn what careers are out there, or even if it's a career fit, but to learn principally who you are and what will work for you in life. And it took me a long time to figure that out, but I think I've got it now. So that's 60 years of professional life in 5 minutes.
Thank you. Do any of the students have any questions for our speakers? And don't be shy, because this is the perfect time to ask them these questions.
Yes. My question is for Kayla. For your job at Beacon, what are your responsibilities on like a day-to-day basis, and are they like psychology related? Because I know I want a career related to psych, but I'm looking for something that like stretches the boundaries of the typical psych job.
So that's a great question. Day to day, kind of like Thomas was just saying, there's careers that I never knew work careers, mostly project management is a huge piece of it, and just kind of organizing people. So in using psychology, like you said, we use it so we design programs and make clinical connections kind of on a day-to-day. So for example, we'll look at data to see, like Thomas was just talking about, like Green River, in some of the comp centers in Kentucky. We'll see, okay, well, this, hospital has an average length of stay of so much, and this hospital has an average length of stay of so much. And so we look at like readmission rates, like there's different quality factors that we're looking for different hospitals. And if there's a hospital that's maybe struggling with some of those quality factors, like length of stay, like readmissions, like some of these things that lead to increased cost of care, then we look to partner with that hospital and say, hey, like what, this hospital over here does X, Y, and Z program, or this is how they connect their people to the next level of care. What do you think about building a program like this? Or how can we help you? So we're using our clinical expertise in a couple of different ways. For one, from our own experience on how we've worked with different CMHCs and kind of how they all fit together. For two, and how we approach the different facilities, and kind of to elicit buy-in, I guess is the way to say it. Just like you would do with, a client one-to-one, like building that rapport, building the relationship, and increasing the trust so that you can kind of work together to collaborate on different issues. So those are kind of the two different ways that we use psychology in the day-to-day. And then some of the things that helped, like with center specifically, was just the experience of liberal arts and being able to keep really random things together. It's not necessarily a piece of psychology, but I think that that's one of the benefits that I have seen from center, is that I can, for example, in my senior year, I remember taking Sanskrit and opera at the same time and making a connection between those two. Anyway, so that always just sticks out to my mind. And so that's something similar that I do now, that if, again, one facility is doing one way, and then I know of a program in California doing something a different way, and they're having these kinds of results, how do I connect those two things, and how do I build that bridge together, is another way that isn't necessarily psychology specific, but it has been my experience with center. Does that answer your question, Emily?
Yes, thank you so much.
Yes, ma'am.
I might add to what Kaylea is saying about the integration of different perspectives. I also have been adjunct professor at several different universities and the Ohio State Medical School. And one of the courses I taught was Aging Patient in Literature. That followed a fellowship that I did at Hiram College, Northeastern Ohio University's Colleges of Medicine, and which really brought these two disciplines together. But I had some students, excuse me, who took this brief seminar because they couldn't get into what they really wanted, like sports medicine or something like that. And others took it because they had not read anything in literature since they graduated from college. And so they were interested in broadening their perspective. One of the things I found most helpful to me is, having majored in philosophy at Center and minored in theater in English, is to be able to use those disciplines in my work as a therapist and as a writer. Because I've written a lot about psychological issues and working on a text in dealing with psychological issues in a theological context, because a lot of people screw up their heads with their theology, and I'm setting out to straighten that out. So anyway, I'm suggesting that you take advantage of the liberal arts, especially if you're going into science, because you might not have it readily available to you then. The other side of that is this fellowship that I had, about 15 scholars from medicine and 15 from the humanities. There are so many physicians who play the piano. and are into special music. So yeah, there is something there that's very closely tied. So that's that.
Thank you, Thomas. Thank you, Kaylee. Do we have any other questions? We have about 15 minutes left. So plenty of time for more questions. Okay, if there's not any other questions, I guess my question to the speakers would be, what do you love best about your career?
I'll go first if that's okay, Thomas. So I know, like I said, kind of speaking back towards what Emily was just asking about, like when I first started with my career, I knew that I wanted some of the experience, but I really wanted to be able to kind of outreach more, kind of like you do, Thomas, with the education and teaching and things. So what I really like about my career now is kind of being able, like we've been talking about, put all the pieces together and organize everything. Because at least with corporations, and I'm sure it's different with small business because it's probably easier to maintain in some ways with small business. The organizations that I've had experience with so far are very disorganized. And so that's what I like to do, is organize stuff and kind of put things in their boxes and piles, and then I can make connections and kind of make things more efficient. So that's what I really enjoy about it. It doesn't really have to do with psychology so much as just organizing stuff.
What I like, I guess what I like best is, well, I'll tell you how I see my work. And I hand this out as a handout to new patients. My job, as I see it, is to try to help folks sort things out, and make issues clear, so they can make decisions that they can live with. Not just in the short run, but over time. And we can do this if gently we unpack the clutter that fills people's lives and helps them sort through and find out what's really important to them, and walk with them as they make decisions around those issues. It works with people, and I like seeing that happen. I like to see them bloom, and when we finish our work, after so many weeks or sometimes years, and sometimes it's just a continuing process in psychotherapy. My job is to work myself out of a job, but some people keep coming back like you do with your primary care physician or getting your car serviced. They just want a checkup. And what they tell me is that they have now got some tools with which to deal with life. I'm glad they are able to take that away. And I was doing a debriefing session with a couple with whom I've worked since right after they got married. And they've now got 2 kids, and remarkable kids. And these are remarkable people as well. The wife and mother said, you know, when so-and-so has such and such, we tell them, and they start quoting me to their family members. And I think, well, I guess what we did took. So that's it.
I agree. Like, I think that part of the fun of psychology is being able to just come alongside with somebody and just kind of be with them and kind of walk with them for that amount of time. Like you said, however long that is, a couple weeks, couple months, couple of years, to just walk alongside of them and kind of help support that life, but also just kind of experiencing what that life is like. You know, it really helps that to just expand horizons and that type of thing, but then also to give tools. So I think that's a really great point of how the beauty, I guess, of the work that we can do.
Thank you so much. I think that was really well put. Do we have any other last minute questions from the students? If not, yeah, you go right ahead. No, you go ahead.
I was going to say one more, I was going to
Yeah.
point out one more thing, kind of like what Thomas was saying earlier. You know, if, and I don't really know what your majors are, what you're thinking about, that type of thing. But I do want to point out that even if your psychology isn't, even if your major isn't psychology right now, that's fine. Even, you know, even if you don't know what you want your major to be, that's fine, because where you're at right now, like, you have the opportunity to apply your work in so many different ways. And especially center is a really great brand recognition in places. Because I know, for example, with my first job at 7 counties, doing the in-home therapy, like, one of the reasons why I got the position is because the person that hired me had friends that went to center, and she was like, I know that this is a really good school. Like, you must be a great, you know, a great student, a great person, or whatever, that type of thing. So sometimes it's just having that name recognition with center. But also, you know, like Thomas was saying, like, you can apply whatever your major is to whatever you end up doing with life, whether it is a field in psychology or something else. I know in grad school, one of the people in my program had her bachelor was in art, but she was able to kind of spin that into art therapy, and she ended up doing some like really cool art therapy things in our program. So I just wanted to kind of put out there that even if you're not sure right now, not sure where you land, just kind of go where you feel passion and where you are really excited about, and it'll work out.
In that regard, in terms of the integration, what Kaylea is saying of different disciplines, it is sometimes recommended, I know in seminary, for instance, it's recommended that people go to seminary not coming from a major in religion, but you do far better if you have a major in history or philosophy or something else like that. You're going to get enough religion in seminary. You don't have to do that. And so I really believe I have benefited from my major in philosophy, not because of what I learned, but because I learned how to think philosophically, and to be able to write with that kind of a perspective and be able to imagine things. The theater minor was helpful to me. I've done some theater since, directed theater. I've been in some theater as an actor. Those things you could carry with you, and the same thing in terms of medical school. What medical schools are looking for is certainly somebody who is bright, articulate, compassionate. I was invited to give the Compassion in Medicine lecture for Ohio Health several years ago, and I had to think about it sort of ironically, that isn't somebody got a reward every year. Somebody gets an award for compassion in medicine, and they presented. I was invited to give this lecture for that big audience of physicians and nurses. I got to thinking, isn't compassion something that goes along with becoming a physician or a nurse? Not always. And so the medical school is looking for people who are well-grounded, certainly interested in medicine, but have a wider range of issues, of values and subject matter. So that's keep your landscape wide, but focused.
That's some really great advice. Thank you, Thomas and Kaylea. I really appreciate it. Well, we've got about 5 minutes left, so we're right on time. Students, if you guys have any more questions, feel free to reach out to the CCPD. We'd be happy to get in contact with Kaylea and Thomas for you. But other than that, if nobody else has any other remarks or questions, I will let you all go and enjoy your day. And I hope everybody has some wonderful holidays this season.
Thanks, everybody.
Thank you.
Thank you.
Thank you.